Not only is our next speaker an associate professor at the Department of Pediatrics at the University of Toronto, but she also practiced law with the Ontario Ministry of Health, specializing in ethics. Now she currently serves as the Director of Bioethics at the Hospital for Sick Children. Please welcome Dr. Randi Zloutnik Shaul.
Hello, and wow, this is just wonderful. I can't help but feel that the future is bright looking at all these amazing folks with such interest in a career in healthcare. Just absolutely wonderful. So I also join the other speakers in thanking the organizers of HOSA for this lovely invitation to be here. It's an honor and a privilege, really, to be able to share my experiences and passion for what I do with a group of you here and in the adjoining room. Okay, so without further ado, bioethicist in a pediatric setting. So by way of my goals, I'd like to provide you with a window into the role of a bioethicist, tell you a little bit about my career thus far, and to provide an opportunity to answer questions. And this might be, if I see you sort of later in the hall, please don't hesitate to come up to me. I'd be happy to answer any questions. What I'll do is talk to you about what is bioethics, what is a bioethicist, what does a bioethicist do. I'll give you some sample issues of issues that we face in terms of in bioethics. I'll tell you this in examples from my particular career, and of course, issues that bioethicists face in other hospitals that aren't pediatric focused might be a little bit different, but we'll talk to you a little bit about those. I'll tell you about the journey in terms of how I got to where I am today, and finish up with some personal reflections. Okay, so what is bioethics? Essentially, bioethics is an interdisciplinary field that seeks to resolve questions of human morality in healthcare contexts. So these can be ethical dilemmas at a macro level, ethical dilemmas that the whole country is facing or that are relevant to the entire country. Ethical dilemmas in healthcare that would be relevant to an organization, so ethical dilemmas that a hospital would be facing. And ethical dilemmas at the micro level, so in terms of the clinician-patient relationship, what sort of ethical dilemmas that might come up in that care, those would be considered at a micro level. So all of these are relevant to the field of bioethics. So what is a bioethicist? It's a professional trained to assist with the ethical problems arising in healthcare and sometimes in healthcare research settings. So there's a lot of technical pieces that we need to learn to work in healthcare, and sometimes in relation to those technical learnings that we have, we're faced with, sometimes we call it in bioethics, the yuck factor. There's something that is sitting with us and feeling ethically uncomfortable, and that might be because our personal values seem to conflict with expectations that come to us in terms of the hat we're wearing. It may be our religion conflicts with it. It may be that the different hats we wear when we're a researcher and a clinician, that somehow the values don't fit nicely together. So these are the types of tensions that can arise where one might want to turn to a bioethicist for some assistance. Typically, with an educational background in philosophy, law, theology, or one of the health professions, an individual goes on and gets additional specialized training in bioethics to then work as a bioethicist. So what does a bioethicist do? In terms of in Canada, accreditation, Canada requires all hospitals to have resources in bioethics in their hospital. So each hospital will have someone who is responsible to deal with or to work with those who are facing ethical challenges. The work that a bioethicist at a teaching hospital will be involved in will be under the categories of consultation. We can have opportunities for health providers, for patients, for families to meet with us as individuals or part of teams when there's an ethical dilemma. We do research in bioethics and research ethics. We do education. All health professions require some education in ethics, and we're involved in that across the health professions, and we help develop policies. So when there's policies for a hospital that has an ethics component to it, bioethics will get involved in that. And essentially what we're doing is helping to embed ethical consideration into all aspects of decision-making in an organization. So how can a bioethics consultation help? It helps identify and address the ethical issues in a particular situation. So again, sometimes people will come to us and they're really clear about the ethical challenge, saying, and I'll give you some examples of what some ethical challenges are. Sometimes they're really clear, and sometimes it's just, there's something about the situation I'm in that's making me uncomfortable. Can we talk about that? And either one is fine. So again, the bioethics consultation aims to clarify ethical conflicts, identify underlying values, and explore moral distress. And by moral distress, we mean sometimes you're asked to do something and you feel that you're not sure about the ethics of that, or you're actually sure that you're not comfortable with it. How do we move forward in a situation like that? So I'll give you some sample issues that have come to us or come to me in my career. And again, this is just a really small sample. Every day is different and exciting. And even after 18 years of doing what I do, it's not, and no 2 days are the same. So this one would be a pediatric patient who is capable of making their own healthcare decisions. But the situation in this case is where the healthcare provider actually doesn't think what the young person is wanting is in their best interest. So you've got that tension between a healthcare provider wanting to act in a patient's best interest, but what the patient themselves are asking for, they don't agree that that actually is in their best interest. So what do we do? A situation where a parent feels that my 10-year-old has cancer and I don't want the team to tell him the diagnosis. How do you approach that? A family wants a female physician for their daughter for cultural or religious reasons. Should this be something that's accommodated in a public healthcare system? Would it be appropriate to say, if the actual physician available is male, to say, actually, can you step aside because actually this family only wants female? What if the request was related to skin color or some other characteristic? Would it be then okay to say, or would it be equally okay to say, actually, you know what, this family is not comfortable with this other dimension of you, would you mind stepping aside? So in a public organization that does not believe in, obviously, in discrimination, what happens if a request comes in these forms? All areas of a hospital can benefit from increased resources. What's the best way for them to be allocated? So at any given time, every different facet of a hospital is saying, you know what, actually there is so much benefit that could come if more resources would come our way as an organization, or even in terms of at the ministry level. How does one decide in an ethically defensible way where the funds should go when you can't fulfill all appropriate requests? When is it okay to try a procedure on a child that has never been tried before? So when is it okay to say, you know what, we've done the research, we've done similar sorts of innovations or similar sorts of activity, now we want to try something we've actually never tried before, actually on a human patient. What do we think should have to be in place before that's okay to do? Are there ever circumstances where queue jumping would be acceptable? If we say access to healthcare should be dependent on need, is it first come, first serve is always the appropriate way? Is it always the sickest? Or are there some times where you'd say it's okay for someone to actually jump the queue? Would it be okay if the child of a politician shows up and says, you know what, actually, I'd like to be seen right away, can I please jump the queue? What about the child of a very busy clinician or a surgeon? Would it be okay to let them jump the queue? So that's another interesting challenge that people have faced in pediatric and adult hospitals. I'm sure people have heard about the recent law around medical assistance in dying, and a lot of debate about whether or not it should be extended to capable minors. That's another ethical dilemma that bioethicists involved in pediatrics would be involved in. In a country that celebrates diversity, what should happen when the treatment that modern Western medicine considers best for a child is different from that being recommended by a traditional healer? So if we definitely want to be respectful of diversity, what happens when the framework that a family is coming with in terms of their conception and understanding and beliefs, deeply held beliefs as in terms of medical treatment, is different than what is being offered in a healthcare setting? How do we approach the differences then? What ethical issues should be considered when preparing for the first face transplant in a child? So again, there are some surgeries and processes that are tried and true for many years, a lot of history, and some that are very, very innovative, where groups will be coming together to plan for them in terms of the technical pieces and also the ethical issues related to them. So that's another one that we've been involved in. Generally speaking, in a hospital, you have just a very small amount of bioethicists. At the Hospital for Sick Children, we have 2.5 bioethicists for the whole hospital. So sometimes access to information is coming from engaging with us personally, and other times we have other forms of resources that people can use. So we've got a website that people can go to, and we have a lot of information there that people can try themselves to wrestle or explore the issues at hand. And sometimes it's feeling that, you know what, I understand the resources that I can access myself. It would really be preferable to meet with you as an individual. In terms of a little bit more about the department that we're involved in, the department was founded in 1991. We have monthly rounds that are open to the whole hospital. This will be our 16th year having an annual bioethics week where we have 18 events across the hospital that people can go to, again, to have a window into the ethical issues that people are facing across the hospital. We're very committed, being in a teaching hospital, to publications, to sharing through scholarship the issues that we do a deep dive on. So a mentor of mine once said, if something is worth spending a lot of time thinking about, it's worth sharing. And we try and do that through scholarship. So we've got 154 journal articles, 18 book chapters, a book that I published recently and edited looking at the tensions and synergies between models of patient-centered care versus family-centered care, and a colleague of mine, a recent publication of ethical issues in pediatric organ transplant. Through the years, we've been part of 128 committees. We have wonderful students and volunteers that work with us. And all of this are part and parcel of what it means to, or the experience of working in bioethics in a hospital like the Hospital for Sick Children. Every organization has an ethics framework. So depending on where you're spending time, you might be interested to speak to the people you're working with to ask them, so what is the ethics framework? What are the values that are relevant to the organization that you're spending time with? And these is a depiction of the ethics, of pieces of the ethics framework at Sick Kids, and that sort of line across the lower half is a window into the ethics decision-making guides, how you might go step by step around dealing with a complex ethical decision you might have to make. Again, I know a theme that has been discussed is that in healthcare, you never are really working alone. So even in pediatric bioethics, we're very much connected to those around the world who are also looking at pediatric bioethics issues. We have colleagues around the world that would collaborate in terms of research, in terms of scholarship. Earlier this year, I was in Australia speaking at a children's hospital there, and the issues are very common in terms of both settings, and actually different in other ways where that offers a wonderful opportunity for learning for all of us. In terms of my personal journey, I did a Bachelor of Arts in Political Science at McGill University, then went to Osgoode Hall Law School thinking that law would be sort of a mechanism that, or a lens that I would be really suited to my personality and interests. During the summers, I worked at the McGill Center for Medicine, Ethics, and Law, and another summer worked in the Legal Services Branch at the Ontario Ministry of Health. So again, even though my lens and interest was law, there was something about the healthcare context that really spoke to me, that felt really significant. And so I chose to use the framework of law and the teachings and education I had in law to help and be of service in terms of the healthcare context. I practiced law in the Legal Services Branch of the Ministry of Health, and while there, became really passionate and frustrated with issues of resource allocation. Again, when it seemed that everyone coming to the Ministry of Health had a really good reason for why they were needed funds, and there wasn't enough to give everyone everything they needed, that was very troubling to me as an individual. So I thought, I'll go away and do a master's in law, especially on resource allocation, and I'll come back with all the answers. After that, I really just had a better understanding of how complex the questions are. So then did a PhD at the University of Toronto, but this time through the medical school at the Institute for Medical Science. After that, I did a postdoc at the Hospital for Sick Children, became a bioethicist there, and 6 years ago became the director of the bioethics department. In terms of a couple of personal reflections before I finish off, I'll say that clearly there is a huge variety of roles in healthcare. So, here you have all these people who are interested in healthcare. It is unbelievable not to feel that, oh no, there's not going to be room for me if there's such a large group here today. The variety of roles that there are in healthcare is quite immense and exciting. So think about the activities that you're passionate about and where your skills lie, and chances are they can be applied to the healthcare context. It's fair to expect that a career with people will be motivated. If you have a career in healthcare, you will be working with people who are motivated by problem solving and compassion for others. It's also fair to expect diversity in how this problem solving and compassion will be expressed when you work with people in healthcare. What I can promise you is that a career in healthcare will never be dull. It'll sometimes be very, very tough, but it will always be a privilege. So good luck to you.
Thank you for your amazing presentation, Dr. Zloutnik Shaul. We'd like to express our appreciation for you coming out today by presenting you with this plaque.
Thank you very much.
Yeah. For you to take a photo. No, you hold it.